your student nurse on duty. So for today's video, we are going to do another return demonstration, and this time it's going to be performing psychiatric assessment. So if you want to know and learn something, so please keep on watching. In performing psychiatric assessment, we have different phases. So for the first phase, which is the pre-introductory phase, we have 3 steps. So step number 1 is to review patient's previous medical records if available. Reviewing patient's previous medical records will help, guide, and assist healthcare professionals during the delivery of care. Also, it will help healthcare professionals to better or further understand the current condition of or the current problem of the patient. In addition to that, it also drives healthcare professionals in coming up or in formulating the best nursing intervention that best addresses the patient's current problem. So step number 2 is to determine the scope of the assessment and prepare for the necessary equipment needed for the assessment. So it is important as well to determine the scope of the assessment, such as the time, how long will it take to conduct the assessment, the place where will be the assessment will be conducted or will be done, and also the set of questions or the tool that will be needed to perform the assessment. That leads us in preparing the necessary equipment needed for the assessment in order to conserve the energy and time of the healthcare professionals as well as the patient for future activities, as well as it displays or it showcases the effectiveness of healthcare professionals in the clinical setting. And step number 3 for the pre-introductory phase is to perform hand hygiene or hand washing. As hand washing is the universal precaution to stop or to deter the spread of microorganisms to protect not only ourselves as healthcare professionals, also our patients and the people that surrounds the patients. Next phase, which is the introductory phase. Step number 1 is to politely greet the patient as well as the patient's companion if around, as it establishes rapport and also sets a positive mood to the environment. Step number 2 is to introduce self and identify patient's identity by using at least 2 identifiers. You can do this by asking the patient to state their name and their birth date to ensure that you are doing the right procedure or the right assessment to the right patient. So step number 3 is to ask the patient to what name they are preferred to be called during the assessment in order to provide comfort and to gain cooperation to the patient or from the patient throughout the execution or performing the assessment. Step number 4 is to explain the purpose and the objective of the assessment, as well as the types of questions that will be asked to the patient during the assessment, including the reason behind the taking down of notes and documentations of the patient's responses and the healthcare professionals' observations during the assessment. So it is important in order to gain patient's cooperation throughout the assessment, as well as informing patients to what type of questions that they will be asked later on during the assessment, serves as a briefing period to them in order to avoid negative mood or unnecessary feeling during the assessment that could ruin or that could determine the failure of the assessment. Aside from that, letting the patient know the reason behind the taking down of notes or the documentation process will let them understand how they can benefit to the documentation and how it is important in addressing their problem. Also, to ensure patient that privacy is best upheld throughout the assessment. Next phase will be the working phase or the actual execution of the assessment. Step number 1 is to begin the interview with an open-ended question that allows a full freedom of response. So using an open-ended question for psychiatric assessment is known to be effective and successful, as it allows patients to express their thoughts, their feelings, their emotions, and ideas that helps healthcare professionals in the identification of problem. Aside from that, using an open-ended question during a psychiatric assessment will avoid patient to feel to be threatened or to be challenged or questioned about their feelings, their thoughts, their emotions, or ideas during the assessment. Next step is to elicit or to obtain relevant information. These are the information that should be drawn out or should be obtained during the assessment. Next step is to use questions appropriately and accurately to avoid misinterpretations and misunderstandings. Also, ask patient questions one at a time to facilitate or to give patient ample time to answer and express their thoughts with regards to the asked questions. Aside from that, also use an open-ended question and direct question as much as possible in order to patient to have a free or full freedom of response towards the asked question. Next step is to encourage patients to discuss their health concerns in their own ways and in their own words, including their health history and their perception towards their health. These things are under the subjective cues given by the patient. So, subjective cues are very important during the problem identification in order to identify the needs of the patient to formulate or to come up with an effective nursing intervention for the patient. Next is to use a variety of therapeutic communication techniques and types of questioning during a psychiatric assessment, because patients are different from another. So, using a variety of therapeutic communication technique and types of questioning during a psychiatric assessment is important because the type of approach that should be used by the assessor or the healthcare provider should fit best with the patient who is being assessed, because the type of approach or the type of therapeutic communication technique that is used with a certain patient, patient A, might not be effective for patient B. That is why the healthcare provider should be patient enough to identify the right approach, the right therapeutic communication technique, or the type of questioning during a psychiatric assessment should be identified in order to be effective in assessing the patient, especially for psychiatric patients that needs to be given extra attention, extra effort when being assessed. And also, the success of the assessment is seen by the completeness of the information that was gathered during the assessment, and of course, the accuracy and appropriateness of these informations. Next step is to use terms or words that best or easily be understood by the patient. As I have mentioned at the beginning of my video, that it is important to assess for the potential barriers to communication, and it includes language and patient's level of literacy. So it is important that the words or the terms that will be used during the assessment is within the patient's understanding, or fits best to the patient's language, in order to gain cooperation and active interaction during the assessment. And gaining cooperation from the patient and having an active interaction will result for the success of the assessment by acquiring or obtaining the necessary information needed for the assessment. Next is to assess for the reliability and accuracy of the subjective cues or the information that was given or that is stated by the patient during the assessment. So obtaining or acquiring information from the patient or the subjective cues means that we value their perception, their feelings, their thoughts on certain matter, and we do not invalidate them. That is why there is what we call objective cues in order to support patient subjective cues, because there are some patients whose subjective cues does not coincide with the objective cues. And also, ensuring the accuracy of patient subjective cues is important in the problem identification and in coming up with the best nursing intervention that will address patients' prioritized problem. Next is to note for the verbal and non-verbal communications of the patient throughout the assessment. So observation falls under the objective cues. So as I have said a while ago, that objective cues are cues or data or informations that support patients' subjective cues. So it is very important for the healthcare provider to observe thoroughly throughout the assessment in order to document and to take down relevant information that will be helpful in order to identify patients' prioritized problem to address them immediately. Next is to exhibit flexibility of the conduct of flow and direction of the interview. So it is very important as healthcare providers to be flexible enough when dealing or when interacting with our patients, especially with psychiatric patients. Aside from that, when we make use or when we are using open-ended question, as it allows for a full freedom of expression, there is a tendency that the conversation or the interview will be misdirect or pwede siyang malihis into other topics, because we do not make use of any structured questions that entail structured answer like yes or no, that makes it prone for misdirection of conversation. That is why it is very important for healthcare providers to be flexible in order to cope up with the flow of the conversation, even if it will be misdirected during the interview. Next is to provide adequate time for the patient or the client to express oneself. So providing or allowing patient or client to express oneself adequately or giving them ample time to express themselves is important in order for them not to feel pressure or feel unusual feeling that could hinder the success of the assessment. Next is to give patient or client adequate time or ample time to express oneself. So it is very important to provide them with an ample time and expressing themselves in order not to make them feel pressure that could make them feel uncomfortable during the assessment. And if the patient or the client will feel uncomfortable or unusual feeling, it could ruin the success of the assessment. Lastly is to ensure to use an open posture during the assessment, because using an open posture during an assessment will provide comfort to the patient, as they will feel that you are interested or you are open towards them. Last but not the least, the summary and closing phase. So step number 1 is to summarize the information that was obtained from the patient during the working phase. So it is very important to summarize these informations in order to identify that you have successfully obtained the relevant information that are necessary or that are needed to be obtained during the assessment. Next step is to validate the accuracy and completeness or the correctness of the information that was gathered. So you can do this, or you can validate the information that was gathered from the patient by asking the patient for clarifications or to restate the information that you have gathered earlier, and to ensure that what you have gathered is accurate and correct and is according with what the patient have stated. Next step is to discuss with the client or the patient the possible solutions or steps or plans that will be taken to resolve the health concerns or the health issue. So it is very important to have the patient involved in the planning of the plan or the interventions that will be used or will be done for the patient. It makes them feel involved. There is a feeling or a certain feeling of involvement in the plan of care that was formulated, especially in order for them to further or to better understand the importance of the set or the formulated interventions to their health and how they will benefit to the set or to the formulated interventions. Next is to assess for patient's understanding of the plan and the need for further teaching. That is why, as I have said, it is very important to have the patients present or the patient's involvement during the planning phase of the intervention or the possible steps or actions that will be taken to address the health issue or the health concerns of the patient. Because by doing so, the patient or the client will have an understanding as they get to interact with the healthcare provider during the planning phase. So they will have a better understanding of the importance of these set interventions for them and how they will benefit from it. Second to the last step is to allow patient or client to clarify things, ask questions, or raise concerns with regards to the planned action or with what was talked about during the assessment. Because these steps or the patient's act of asking or clarifying things or raising concerns signifies to the healthcare providers that the patient or the client is interested during the plan of action or is paying attention during the assessment. Lastly is to not to forget to thank patient or client before ending the interview for the time and effort that they have exerted or they have given throughout the assessment as they have participated during the assessment. When you are ending the interview politely or thanking them, it signifies to them that you appreciate their presence or their participation during the assessment. Also, do not forget to do hand washing or hand hygiene, as it is a universal precaution to deter the spread of microorganisms, to protect not only ourselves as healthcare providers but also the patient and our surroundings. Thank you. And that's it for today's video, and I hope that you have learned something from your student nurse on duty. And now I will be inserting a clip or a video wherein I perform these steps in order for you to be guided on how to turn these steps into action. So thank you, and do not forget that mental health is wealth. Hello everyone, so for today's video, I will be doing another return demonstration. And this time, it's going to be a psychiatric assessment. So for demonstration purposes, I will be removing or I will not be using my face shield in order for me to fully perform the said assessment. Ma'am, good morning. Mayong buntag. Ma'am, ako di ay si Ayora Maiso from Davao Doctors College, and today, ma'am, I will be conducting a assessment, mag-conduct ng assessment para sa imong mental health or mental status. Ma'am, pwede ko mamatanan sa imong pangalan o birth date? Pangalan o birth date, ma'am?
Fecho.
Birth date, ma'am?
November 7, 1994.
Tapos, so ma'am, kamusta man ka karon, ma'am? Mayo man. So ma'am, natay mga pangutana diri na magsugod siya sa easy to medyo lisod. Tapos na mga utana nga medyo mailang ta. Pero kani mga pangutana, ginapangutana ni sa tanan pasyente para mas masabtan or mas ma-assess na to ang imong mental health status. Yan ma'am. So ma'am, magsugod ta sa pila atong edad karon, ma'am. So ma'am, kung mapansin nimo or asing matingala ka nga taga-pangutanan ako sa imong kay nagasulat ko or naga-take down ko og notes, kay naga-document ako ng documentation. Bali mo na ni siya imong record sa amoa, manani mo medical record sa para next visit nimo na naka-record, matrack na nato imong progress. So, mo to ma'am. Mangutana ko ma'am, kabalo ba ka asa ka karon?
Nasa balay.
Maayo, nasa balay. Masa ganipit sa karon, ma'am?
April 7, 2021.
Masa adlaw karon, ma'am?
Wednesday.
Wednesday, maayo. So karon, ma'am, na ako'y ipabasa sa imong ma'am.
Dark Night Side 5.
Very good, ma'am. Tapos, naadit ko ipahinumdum sa imong ma'am nga tulo ka words na unya after 5 minutes, ipangutanan ako kung sa to akong ipahinumdum sa imong. So first, kay blueberry.
Blueberry.
Next, kay cute poppy. Last is sweet orange. Blueberry, cute poppy, sweet orange. Ma'am, very good. So next, ma'am, is pabasa ko, ma'am.
Not your hands, 3 times.
Very good, ma'am. Next po is pasulat ko sa ato ang name, ma'am. Sa atong name. Very good. Tapos, ma'am, pasulat po ko sa ako ang ingon, ma'am, ha. It is a rainy day. Very good, ma'am. Tapos, next is Nakatay drawing na ni ma'am. Ang akong gusto buhaton nimo or akong ipa-ask nimo ha ma'am is ato ha siyang kopyahon ma'am. Okay lang ma'am kung dili siya ay perfect na copy, ato lang siyang i-sundog. Salamat, ma'am. So, karon ma'am, if muadto ka sa pinakaduol ninyong mga palengke tapos magpara ka og motor, asa man nimo iingon sa motor pag magpahatod ka sa inyong palengke?
Mato ka sa mental palengke.
Maayo. Tapos, asa gani ni siya, ma'am?
Hello.
Hello. Kani siya, ma'am?
Bullpen.
Maayo kani, ma'am?
Alcohol.
Very good, ma'am. So, unsa ganito akong ipa-remember sa mo ganina, ma'am?
Blueberry.
Blueberry,
Sweet poppy.
cute poppy,
Sweet orange.
sweet orange. Very good. Thank you, ma'am, sa pag-cooperate sa ato ang assessment. And kani nga document, ma'am, i-ensure na ko nga dili ni siya mapadulong sa maski kay kinsa or maski kay asa. Kani nga document mo ni siya mag-serve as imuhang medical record sa mua para next visit nimo matak na nato ang imuhang progress. Thank you kayo.